Good afternoon and welcome to James Michael Bowers, legislative candidate from District 46. Thank you, James, for joining us for our virtual legislative candidate meetings. My name is Gina Ragland, and joining me today are AARP lead advocacy volunteers Joyce Beck and Mike Barwig. Janet Davis is planning to join us. She may have had some technical difficulties, so again, if she does come back in, we'll introduce her at that time. As a reminder, this meeting is being recorded and will be shared with AARP members across your district prior to the election. James, we appreciate your taking the next 30 minutes of your time to meet and discuss issues of importance to the 50+ voter and their families in your district and across Nebraska. As a little bit of background, AARP is the nation's largest nonprofit, nonpartisan organization dedicated to empowering and strengthening people 50 and older to choose how they live as they age. As people live longer, healthier lives, we know we need to think differently about what it means to age. So with that, James, if you want to start us off by giving us a little background about yourself and your campaign in 5 minutes or less would be great. And once we've completed your opening, we'll move into the questions. So I'll hand it back to you. Welcome, James.
Thank you so much for allowing me to come out and chat with AARP and everyone who's watching this. My name is James Michael Bowers. I'm a social worker, a therapist, and I'm also currently a member of the Lincoln City Council. I'm running to represent North Lincoln in the Nebraska Legislature. I first got into politics through my work as a social worker and seeing the challenges and the barriers of DHHS and how policy can either help some children, families, and seniors in our state, and how sometimes even well-intended policy can harm children, families, and seniors in our state. So I'm running to make sure that we bring a frontline voice to the Nebraska Legislature, someone with a proven track record of getting things done in our city, especially during some of our community's most challenging times, and looking to really bring a good, solid North Lincoln voice to the Nebraska Legislature.
Perfect, James. Thanks for the background, the information, and again, thanks for all you do for the City Council. We do appreciate that as well. We'll move in now to the question portion. We provided you with a set of 3 issues containing 4 questions pertaining to the 50+ in Nebraska. And again, due to our time allotments, we'll go about 5 minutes for each of those questions. So our first question this afternoon is on health, caregiving, and home and community-based services. And Mike Barwig's going to take that. So go ahead, Mike.
Good afternoon, James. Nice to have you with us. Home and community-based services, also known as HCBS, provides an array of services designed to assist individuals with activities of daily living that promotes independence to support them age in place or delay institutional care. A family caregiver is any family member, friend, or acquaintance who cares for another person that is unable to live independently, and often these people do this without pay. Telehealth services can be significant for older adults in rural areas or underserved communities, while also providing support to family caregivers by reducing travel, wait times, and costs associated with in-person care. The first part of the question is, what would you do to support the 240,000 unpaid family caregivers in Nebraska through policies such as enhanced respite services, access to telehealth, caregiver education and training, and help with out-of-pocket costs? The second part of the question is, what will you do to protect and/or expand the home and community-based services, HCBS program, particularly recruitment and retention of a sufficient workforce and adequate funding of the services that Nebraskans and their families rely on?
Thank you so much for that question. As a caregiver myself, there have been times in my life where I've had a parent who has undergone some serious medical concerns and currently has some chronic health conditions where that parent has had to move in with me, and I've been their sole caretaker. So I know intuitively what it's like to be a caregiver. And in addition to that, I also know that most people don't get what it's like to be a caregiver. People might think that they understand, but until you walked in those shoes, no one knows the amount of strength, dedication, passion it takes to overcome some of the most hardest and frustrating things about being a caregiver. So it is crucial that we as a state support family caregivers. Currently, I do not believe that the state is doing enough to support family caregivers. There's a couple different things that I think that we should do and look at policy-wise to support family caregivers. So if we start with employment, if we make sure and codify in statute protections for caregivers that have to leave work to care for a family member, if we make sure that we prohibit firing from taking time off to care for a family member, and making sure that we have family leave policies that include parents and folks that individuals may be caring for. In addition to that, I think that as we talk about the home environment itself, so we have the caregiver and their employment and how they're making a living, but then also in the home environment, it's important that the state has programs available to help for reimbursement of modifications to home or to technologies. Wheelchairs are expensive. Medical equipment is expensive. And we need to make sure that we help folks get that the tools they need in order to take care of their family members if that is the route that they're going. We do know that when we invest in caregivers and when we invest in in-home care, we're saving money and we are saving spaces in assisted living and nursing home facilities. I also have a concern with one of the current policies where in order to become a personal care assistant, that is not available to spouses. And I think that that's something that definitely needs to be looked at. Typically, family members that are caregivers tend to be within, the close nuclear family. And I know from my own experience, the parent that I took care of would much rather have a close family member provide those needs than maybe an extended family member. So I think it's important that we look at how those dollars are being spent and who we're giving them out to, because I think that we need to have a conversation about should spouses and parents be included in that. In addition, when we talk about home and community-based services, I think it's important that we expand the functionality of those programs and expand accessibility into those programs. Getting signed up for those programs, in my experience, has been a confusing process. And I have a master's degree, and on the city council, I look at policy every day. And I still had a hard time figuring out some of these avenues. So I know that if I'm having a hard time figuring it out, that I'm not the only one who has experienced that complexity. And some of the, I don't know if lawyery is the right word to say, but some of the complex language that goes into it and eligibility and services that are available. And unfortunately, it seems like we learn a lot of these lessons a little too late, and we either have missed a window or missed a criteria or missed some documentation that could have saved a lot of heartache and could have saved a lot of stress, especially when these services can be very confusing and an added stress getting signed up. We also need to look at increased payment for services. We need to have some conversations about where dollars are going to come from. And we need to start making care of senior citizens and making sure that people have the ability to live independently a priority. Through my work as a social worker, I am really concerned about what the next 20 years are going to look like, especially as we have an aging population. I didn't get into social work originally to work on aging issues. However, throughout my career, I've seen that this has become a crucial, critical issue that has not gained enough attention and do not have the amount of dollars and resources available. In addition to that, some of these programs are available only in certain places in the state. I believe the PACE program is only available like in Douglas, Saunders, and Cass County and Washington County. And I think that we need to look at expanding programs to be statewide. We know that we have an aging population all throughout our entire state. And we also know that services are not available throughout our entire state. And so we need to, when we look at how we are going to provide services, we need to make sure that we are including all of Nebraska and not just limiting to one specific area. So in short, in order to make sure that we expand and protect home and community-based services, we need an advocate, someone that has the strong frontline experience and has the personal experience to know what the challenges are that families face when getting connected to services. We need to have brave conversations and people who are willing to have those brave conversations to address an issue that's already at a critical point, but is only going to increase in need as time goes on. And we need to stand shoulder to shoulder with family caregivers and make sure that when they are doing one of the hardest jobs in this world, one of the most emotionally draining jobs, but emotionally fulfilling at the same time, when your relationship with the person that you're taking care of changes from the typical relationship that a parent and child might have, that's something that is hard to put into words, but other people who have been through it know it and get it. And we need to stand shoulder to shoulder with those people that are taking care of family members.
Very good. Thank you for your answer.
Thank you, James. Our second question now goes on to talk more about facility life for older Nebraskans, and it's on nursing facility quality. And Joyce Beck's going to take that. So go ahead, Joyce.
Okay, thank you, James, for your time. And as a former family caregiver, I appreciate your deep understanding of how difficult that is. But as far as nursing homes go, over 20,000 Nebraskans require care in nursing facilities or assisted living communities. Facilities have closed their doors, and they cited reimbursement challenges as well as staffing shortages. Nebraska will need an additional 4,700 more nursing assistants, LPNs, RNs by 2028 to meet Nebraska's care issues. Everyone, regardless of where they reside, deserve to be treated with dignity and respect and have access to quality medical care. Better staff to resident ratios improve the overall quality of care and the well-being of residents. Workforce recruitment, retention, and job satisfaction challenges are prevalent across long-term care services and support industry. Causes of workforce shortages must be identified and implemented to respond to the growing need for high-quality care. So, James, my question for you is this. What would you do to improve the quality of nursing facility care for Nebraska residents, including addressing the growing long-term care workforce crisis in the state, professional education and training, and accountable facility reimbursement?
I'm going to break that answer up into three areas also, because I think that we can talk about before going into long-term care, while folks are in long-term care, and the holding accountable of long-term facilities. So I'm going to talk about each of those three areas pretty briefly. As I mentioned earlier, and as we are all aware, if we are able to provide services in home, that is one way to reduce the amount of folks that are in long-term care facilities. If we are able to put more dollars into the prevention of going into long-term care facilities, and I mean like, providing support to family caregivers and tools in order to help folks stay in their home, that's definitely one way to prevent the need of in long-term care facilities, especially as we have an aging population. Unfortunately, in my experience, I know that sometimes prevention dollars and programs are a hard thing to get across the finish line. While I'm talking about that, I want to mention one of my accomplishments on the city council that I'm most proud of that kind of relates to this, where within the city, we were able to get a budget item pushed through to provide what's called universal home visitation. So every newborn in the city and in the county, once the county finishes their budget process, will have access to a registered nurse for 3 visits, with the first one within the first 3 weeks of life. And that's to provide assessments and to provide family support. And that program has been scientifically proven. It's a low cost. And my reason in sharing that is it does all of these wonderful things, but still we have decision makers who are so focused on being reactive instead of being proactive. And so we need to make sure that we are looking at ways to prevent the amount of folks going into long-term care facilities as long as they're within a safe environment and home, okay? The second thing, when we talk about the nursing facility itself, again, I agree. We need to make sure that we have appropriate staff ratios with appropriate education. And we need to make sure that those medical professionals have the tools that they need in order to do their jobs, like personal protective equipment, and also making sure that we look at how Medicaid rates are being doled out to providers. So in addition to being a social worker, I'm a therapist, and I'm also a Medicaid provider. And one thing that I hear when I talk with Medicaid providers, from mental health care to physicians to nurse practitioners all across the board, is how it is becoming more and more difficult to accept Medicaid dollars and to be credentialed within Medicaid, either through the bureaucracy of Medicaid or also through the how much they are receiving. And it's not uncommon to hear people say that when they accept a Medicaid patient, that they're actually losing money in taking care of those folks. So it's important that we look at making sure that our Medicaid rates are at a higher level and reflect the level of care that's actually being provided. Once we address the Medicaid rates, I think that will be one of the things that does address our workforce shortage, because the low Medicaid rates, it's not just a Nebraska thing, right? This is a national thing. However, if Nebraska can be known as one of the states where Medicaid is easy to work with, where Medicaid pays the dollars to its providers, I guarantee that we are going to attract the best and brightest into Nebraska. People want to work with the people that they went to school for to serve. They want to do this. However, the financial concerns or the fears of their practice being shut down are very real, legitimate concerns. And if we can create that culture of Medicaid paying fair rates, we are going to be bringing more people to Nebraska to work in these areas. I guarantee it. And then when we also look at education rates, I know sometimes it could be easy for folks that don't necessarily understand scope of care. And what I mean by folks who don't understand scope of care, I mean decision makers who are in these positions and may not understand the difference between a registered nurse or a licensed practical nurse and a nurse practitioner and a physician's assistant, right? When decision makers do not understand the scope of practice, then it is easy for folks to want to go to maybe the lowest possible education or the lowest possible competency available in order to provide the basic need. However, as we know, we need to have appropriate levels of trained professionals in order to have good outcomes. Kind of like with the Universal Home Visitation Program, I had to spend time talking with community members about the difference between a registered nurse and a certified nursing assistant, and why a registered nurse can do a head-to-toe assessment of a child and can provide screenings for postpartum depression and anxiety, while a certified nursing assistant could not. So we need to make sure that we have appropriate scope of practices and appropriate trained professionals in place. So those are some ways that I think that we can address the workforce shortage. One other thing that I want to throw out there has escaped my mind. During the day, I work at a middle school, right? And I work with the preteens who are getting ready to go to the next chapter of their life of high school. And there are so many opportunities that are available to help get students onto a career path that could interest them. However, we need to make sure that every student in every area knows about the different professions that are available. It's not uncommon for folks to think that the two jobs that exist in the medical world are doctors and nurses, when in reality, we know that there is a wide spectrum with a wide variation of what that lifestyle will bring. And I think it's important that we bring those earlier on to folks. What led me into social work was working in the social work field. I was a volunteer with a food distribution site here when I was like 16 for high school credit. But because of that, I took an introduction to healthcare occupations class in high school. And that blew my mind, because then you're able to learn about like what it means to be a medical transcriptionist, what it means to be a pharmacy assistant, what it means to be a phlebotomist. And once we are able to help the next generation know all of the options that are available to them, ranging from maybe a community college level all the way to medical school, that's going to make the medical field more approachable for the next generation. In addition, when we talk about holding long-term care facilities accountable, it's important that we hold poorly performing nursing homes and long-term care facilities accountable based on specific metrics. Now, this doesn't always necessarily mean a punitive approach, but we need to have tools available to help support long-term care facilities who may be struggling just as hard as independent providers in meeting the needs of patients that they're serving. But just because folks are struggling does not mean that we should allow inappropriate levels of care to happen. So I think it's important that we have metrics and have information that is provided so folks can make a decision on where they want to go to if they're fortunate enough to live in a facility where they have multiple choices, but then also helping nursing homes identify appropriate policies, making sure that when it comes to caring for folks that are living in their long-term care facilities, make sure that there's things in there for reducing isolation, making sure that we have policies on the book where some of these folks that are working in long-term care facilities don't have to work multiple jobs at multiple long-term care facilities in order to meet their basic needs. Making sure that we have appropriate response protocols in place, and making sure that we have protocols in place also to look at unnecessary pharmaceutical interventions when it is not needed. Of course, pharmaceutical interventions are an appropriate intervention. I do not mean to imply that they are not. However, I know through my work that sometimes pharmaceutical interventions are used when there are definitely other avenues that should be pursued, like having more staff available and more staff and having lower staff to patient ratio. So that's kind of how I think that we should reduce the crowding of long-term care facilities, how we should support the staff that work in long-term care facilities, and ultimately improve the amount of folks that are working in these facilities, and also how we can help hold those long-term care facilities accountable while also being supportive at the same time.
Well, James, thank you so much for those answers. I appreciate your input.
Thank you,
Thank you
James.
so much.
Our final question for discussion today centers around livable communities and helping people stay in their home. And Janet Davis will take that one. So go ahead, Janet.
Good afternoon. Another important aspect of living a fulfilled life is to reside in what AARP refers to as a livable community. Several aspects are included in a livable community. It must be safe and secure. It offers affordable housing and transportation options that allow individuals to travel by multiple means. And it provides supportive community features and services for people of all ages, allowing people to remain in their communities as they age. And that's not all. It also needs to be affordable and have affordable and reliable healthcare and transit options are critical to support older Nebraskans aging in place. We need high-speed internet, which is affordable, reliable, and accessible for all Nebraskans. And in order for that to be accessible, digital skills development is also essential to obtaining the benefits of high-speed internet access in our homes. So our third question for you today is, what will you do to ensure all Nebraskans, and we're looking at people 50 plus, have access to livable communities which offer affordable housing, diverse transportation options, adequate health care, and affordable, reliable, and accessible high-speed internet, including digital skills development?
Absolutely. As AARP is definitely aware that there's certifications available, or I'm blanking on the exact words, that declares a place a livable city for seniors. And I think that's definitely something that municipalities need to look at in terms of, it provides those benchmarks in how can cities do better for the aging population and to help folks age in place. Affordable housing is definitely an issue that in our state that affects everyone across the lifespan, but especially as we get into the aging population, We have folks that, my mother, for instance, she was living in a 2-story house, and the shower was on the 2nd floor, and that just did not become a viable option anymore. And so if we do not have affordable housing options available, people are either forced to stay in a home that may not be particularly safe, or find a place that they can't afford and then have to make hard choices about medication, rent, or food. Or what I'm deeply concerned is going to become more common, and that's end up homeless. And I'm not saying that as a fear tactic. I mean, this is ever since the first day of my campaign, I've been campaigning on senior issues, and it's on my walk card, my very first one even, where I said that we need to start addressing these issues now before we have a big aging homeless population. Some things that I think that we need to continue to look at are, the accessory dwelling units, missing middle. I think that always expanding the homestead exemption for property taxes is definitely an option. If affordable housing units don't have the possibility of being built, then we need to start looking at other ways to provide relief immediately. And I think that expanding the homestead property tax exemption is definitely a way to do that. So more people could qualify if they're staying in their home or if they're looking to move somewhere else. When we talk about healthcare, I think that the legislature, and as a healthcare provider myself, we need to look at creating a licensure compact, especially for telehealth services. So what do I mean by that? I mean that as a Nebraska mental health therapist, I cannot work with someone who may be living in Iowa unless I'm credentialed in Iowa. And this has created a lot of confusion for providers, especially during COVID when telehealth started to boom. And I am a huge believer of telehealth services. I think that it needs to be accessible. We need to make sure that insurance companies are providing appropriate rates and not just paying providers half, because I mean, you're providing the same service, it's just through technology. And we need to clear up the confusion and make it easier for providers to provide services. Because if we already have a shortage of healthcare providers and these services can be provided through telehealth, it does not make sense to me why we would then limit people from providing those services to those who need it the most in our community. And within that, this conversation about broadband internet has continued to grow over the past more than couple of years, where we need to make sure that we have the infrastructure put in place. Telehealth is a valuable tool, but we must have appropriate internet speeds to provide that. And I found, I'm going to kind of go off on a tangent here, but like I've noticed that, folks that are passionate about broadband, once we bring up the healthcare side of it, that adds more motivation and more passion and more reason. But it's also important to make sure that when we talk about telehealth services, that we do not miss out the broadband internet, because we can have really appropriate telehealth regulations, but if we don't have the broadband internet to do it, then it's not going to serve as many people that is available. The other thing that I've already kind of touched on and mentioned on is when we talk about making sure that people have healthcare and housing and transportation, we need to make sure that we continue to fund things like the Aging and Disability Resource Centers, and we need to make sure that we continue to fund these services that provide counseling services and case management to folks that are seeking care. Because, as I stated earlier, getting in contact with these services, trying to figure out how to navigate these problems is complicated. It's difficult, and it is not easy for the average resident to understand. And I think that we need to, if we're not able to, for whatever legal reason, if we're not able to clarify that from the state, then we need to help providers be the translators then in helping the community understand, and to then be advocates for those folks getting in touch with providers. While on the city council, when we talk about transit, on the city council, I'm really proud of our paratransit services that we offer to folks. And I was really proud that we offered fare-free busing during the COVID pandemic. I, of course, wanted to see zero fare transportation continue. However, that was not a political reality at that time, and I didn't want to pretend that it was. But I don't think that we should give up the goal of having zero fare busing in our city. Other municipalities have done it. Omaha has 0 to 18 zero fare busing. And we need to look at what we can do to expand that, not only in Lincoln, but in other municipalities. And if we're not able to do zero fare busing, then we need to make sure that folks that are aging and our aging population definitely have zero fare busing in order to get to doctor's appointments. Transportation, I think, is one of the unseen, and I know I'm running out of time, so I'll wrap up this answer. I apologize. But transportation is definitely, I believe, and in my experience, kind of a unseen, unprioritized issue. And I think it's because so many people who not only are not family caregivers, but then also have transportation themselves. And it is difficult if you have a family member who is not able to drive, and you are now responsible for the transportation of that to those medical appointments. You're taking a lot of time off work. You are spending a lot of time driving around from place to place. That person may be eligible and capable of riding a bus, but because of inadequate transit solutions that are currently existing, they may not be able to. And so transportation is a hidden issue that we definitely need to bring to light when we talk about solving some of these most difficult issues, because it is a basic need. Getting to these appointments is a basic need, and it could mean life or death.
Thank you so much. Some very good thoughts. You pointed out some things that I, as a senior citizen, had not thought of either. So appreciate all the research that you've obviously done and your experience with the city council. That helps a lot.
Thank you so much.
Thank you, James. We're now coming to the end of our meeting. I would like to offer back to you a couple of minutes for any closing thoughts or comments you have directly for our members and constituents of your district. So I will pass it back to you. Again, we have about 2 minutes left. So go ahead.
Thank you so much. Issues that deal with the aging population need to be prioritized. These are critical issues that are not currently being addressed by many decision makers and many policymakers. A lot of people may not understand what it's like to be a family caregiver or to go through the medical conditions as someone goes through the lifespan. We need to have people in office who understand what the reality is like, not the theoretical, but the reality. And someone where it affects them to the core of who they are, because they know what it is like to have that fulfilling, stressful, impactful job of taking care of someone that they love, while also at the same time seeing how some of these policies can, like I said earlier, help people, or well-intentioned policies that harm people. I have that experience. And in addition to that, while in the city council, I passed more ordinances and initiatives than any other city council member, and all of it has been done with bipartisan support. And where I've been able to find my lane in getting things done is using my work experience as a social worker and a therapist to tell stories, and then also to decode some of these really complex issues as it relates to medical issues, scope of practice, and even social issues, which may seem easy to understand at first blush when you look at it. My name is James Michael Bowers. I'm proud to represent folks on the city council. I'm proud of my experience as a social worker and a therapist. I'm ready to get to work and make this a priority issue, because we need to get a hold on it now, because I'm really concerned about what the next 20 years are going to look like, and we'll stand shoulder to shoulder in doing it. Thank you.
Thank you, James, so much for taking the time to visit with us today. We wish you the best with your campaign. And again, thank you so much for meeting with AARP today. Take care.
Thank you.
Thank you, James. Thank you.
Thank you.
Thank you.
Appreciate your time.